Welcome, my name is Dr. Anthony Youn, America's holistic plastic surgeon, and if you're watching this video, you are interested in enhancing your breasts because basically you feel that your breasts are too small. So what I'm going to do on this video is talk with you about all of your various options, the risks, the benefits, and we're going to primarily talk a lot about breast implants today. So let's start by talking about what are the many scenarios. Well, some people who have breasts that are too small for them, they've basically just never really developed. Other people have developed what we call postpartum involution, where after having children, their breasts have gotten smaller. Weight loss can cause your breasts to shrink in size as well. And some people, believe it or not, have had a breast reduction to actually make their breasts smaller. And as the years have gone by, they found that maybe this wasn't the best decision for them, or maybe they've lost some weight and the breasts have gotten smaller as well. And there are still others where they have had breast cancer and are interested in breast reconstruction. If you're interested in breast reconstruction after breast cancer, call our office and we're happy to refer you to a board-certified plastic surgeon who specializes in that because that is not something that I do all that regularly anymore. All right, so what are some of the treatment options? Well, the first thing is non-surgical. One of the non-surgical treatment options is called Brava, and this is basically this device where there are two large suction cups that attach to your breasts and suction them larger. This came out, back in the 90s, and as far as I understand now, I think they're out of business. So this is not something that is available anymore, and it really didn't work all that well. Fat injections are another option, taking fat from a different part of your body and injecting it into your breasts. And I do perform this operation, but in very select instances. And breast augmentation, utilizing a breast implant at this point, is the gold standard for making your breasts bigger, and we'll talk a lot about that in this video. Well, what about fat grafting to your breasts? Well, basically what this surgery is it is a surgery where we take fat from your tummy or your hips or your thighs, basically by performing liposuction, and then we take that fat, purify that fat, and then inject it into your breasts. A portion of that fat will stay. Anywhere from 25 to 50% may stick around. This is a surgery where the best way to, describe it is you're having liposuction, and instead of throwing that fat out, you inject it into the breasts. So what are the risks of this surgery? Well, the surgery itself can take several hours depending on how much fat is removed, depending on your anatomy. So there are always potential risks of surgical risks, which would be bleeding, infection, and anesthesia-related risks. But one of the issues that I'm concerned about, and I'll talk with you in just a second in the recovery, is the risks of what happens to that fat after it's put into your breasts. And that's something to definitely consider. As far as the recovery usually is pretty similar to recovery from liposuction. The actual trauma to your breast with injecting fat may make you a bit sore, but it's the lipoed areas that are going to be most of the soreness associated with this surgery. So that's going to be more or less the main part of your recovery. It is very important to keep in mind that if you're considering fat injections to your breasts, it's typically a pretty modest change. You may get a cup or less of an enhancement. So if you're a B and you want to be a small C, then this could potentially work for you. However, if you are an A and you want to be a full C cup, fat grafting the breast, very unlikely to do it for you. Okay, so it really is something that is used for pretty subtle enhancements of the breast. It's not something that's a big change. My main concerns with this surgery, and why I don't recommend this as a first choice for patients, is the potential risk of alterations to the mammogram and issues with stem cells. So what do I mean by this? Well, anytime you inject something into the breast like fat, it can create changes in your mammogram. Those mammographic changes, usually if you have a good radiologist, those changes can be differentiated, can be separated from something that's potentially more dangerous, like a potential breast cancer. But it is possible that maybe a radiologist can't quite tell if those calcifications are healing from fat injections or a potential cancer, and that may necessitate you having to have a biopsy or something like that to try to determine whether that's truly just a change from the fat injections or something surgical. The other question that I have, the main reason why I also don't do this, is the potential risk of stem cells. Now we know that fat is chock full of stem cells. And how does the body react if you have all those stem cells injected into your breasts, which we know that 1 in 9 women get breast cancer in their lifetime. And so because of that, we don't know. I mean, would those stem cells potentially increase your risk of future cancer later on? Until I know this for sure, this is not a surgery that for me, that I would do as a first choice. Let me just show you a couple of pictures. This is a patient who I injected fat into her breasts, and you can see that the fat itself has enhanced her breasts and gave her a nice change, but the change is pretty subtle. Now, she had previously had breast reduction by another surgeon, felt that her breasts had been over-reduced, and I just injected some fat to give her some volume back. All right, so the main thing we're going to talk about is breast augmentation with implants. And if you're thinking about a breast augmentation, there are 4 major decisions you want to make. And those are what size incision to use, what type of implant to use, where the scar goes on or near your breast, and where the implant goes above or under the muscle. So we're going to talk about all of these. So everybody comes in with different sizes, and then everybody picks a different size for themselves afterwards. Okay, so really in the end, it is up to you what size you pick. And in my office, the decision is not made by me, because I don't know what's going to make you happy. Only you know what's going to make you happy. So I work with you to find the appropriate size to make you happy. So how do we do that? Well, the easiest thing is we can use sizer implants in a bra. Basically, we have temporary implants, we put them in a bra, and you can look at our 3-panel mirror to get an idea of how that would look. The other thing is you could try the Rice test at home, and this is very simple. All you do is you take a nylon stocking, you fill it with rice, maybe 300, 400 cc's or milliliters. You flatten that into a discus shape and put it in your bra. And that's pretty similar to what we do with our sizer implants. The other thing we can use is Axis 3D. This is a computer imaging device where we can use it to help determine how you might look in a 3D fashion with certain sizes of breast implants. All right, now let's talk about the different types of implants. There are traditional saline implants. The good thing about traditional saline implants is that they're less expensive. They're about $1,000 a pair. They're filled with sterile salt water, so it's just salt water, and if they break in general, it's pretty easy to clean them up. But what are the negatives? Well, they don't look or feel as natural as the other implants. And what people especially don't like with saline are the wrinkles and the ripples that you can see and sometimes feel with these implants. And so because of that, the traditional saline implants in my practice are really not used all that commonly. Well, the newer saline implants are called the Ideal Implants. And these are saline-filled implants that have internal shells or internal chambers that allow it to look and feel a bit more natural. So instead of that salt water sloshing around inside the implant, that saline is enclosed in 2 separate chambers. Okay, and that can help the implant look and feel a bit more natural. And it does have the same cost in this office, approximately the same cost as silicone. So it's definitely more expensive than the traditional saline. Well, what about silicone? Silicone implants look and feel more natural, but they are more expensive, and you have to consider that the FDA recommends that you get an MRI 3 years after surgery and then every other year thereafter. Okay? Silicone implants are more difficult to monitor whether they're broken versus saline, and that's why the FDA recommends this. Now, this is not a requirement. You don't have to do it. If you don't do your MRIs, the FDA police aren't going to come knocking on your door, and I'll tell you that my experience has been in the vast majority of patients don't get these MRIs. You have to be 22 years or older for it to be considered an on-label use, meaning the FDA recommends its use only in women who are 22 and older. What that means is basically you can still have it done if you're under 22, but if your implant breaks, there's a possibility that maybe the warranty, they won't allow it because it is an off-label use. All right, well, let's get a little bit into the silicone implant controversy. Now, the old silicone implants that were used back in the 80s and 90s contained a liquid silicone, and these implants were banned by the FDA between 1992 and 2006 because there was a concern that many women had between a possible connection between silicone implants and connective tissue and autoimmune diseases. And so there were lots of women who at the time said, hey, I've got these symptoms of autoimmune disease, whether it's fatigue, rashes, pain, and I think it's connected to my breast implants. And so the FDA banned the use of them in '92 to study these implants more. Well, all of the large-scale studies did not support this connection. So in 2006, the FDA lifted the ban on silicone implants, and they started being used again widespread. But is that story over? Well, it is not. So over the last several years, the topic of breast implant illness has gotten more and more coverage and more people concerned about it. There are several online groups, some of them with tens of thousands of members, who are women who have silicone breast implants, and they have symptoms like fatigue, rashes, muscle aches, joint pain, and even hair loss. And so they congregate, to share their stories, because unfortunately, some doctors aren't listening to them. Well, I have done an extensive search of research on this, and I've found that yes, there are some new studies that show a possible connection between silicone breast implants and breast implant illness, these types of symptoms. These studies are not 100% conclusive. Obviously, they disagree with some of the older large-scale studies that don't show a connection there. So it is important for you to take this into account with your decision making. I, as a plastic surgeon, do believe that breast implant illness does exist. I think it's likely in a very small percentage of women. I do have some patients of mine who I think, and my patients think, have had some breast implant illness. And for some of them, we have taken the implants out and their symptoms have improved. So once again, I think it's a very small percentage of women. I do think that those possibly at higher risk may be those with a history of autoimmune issues, maybe severe allergies, and if that describes you, you may want to consider going with a saline implant over silicone, or maybe not having the surgery at all. Okay, if you feel you can lead a completely happy life without breast implants, especially if you have autoimmune issues, if you've got severe allergies, then you may want to consider not doing breast implants, because we don't know how you may react to them. Okay, so I do a lot of breast implants, and the vast majority of my patients do not show these types of symptoms. But I do believe in a very small percentage of women this could occur. If you're interested in learning more about breast implant illness, I do have a podcast where I really go into the latest research, comparing that to some of the other research on breast implant illness, and my beliefs of what I do for my patients and how I believe about it based on the research that I've done and all the patients that I've treated. And we're also going to put that up on YouTube by the time you watch this video, I'm sure, as well. Well, what about silicone implants today? Okay, knowing this, if you're still interested in silicone implants, which once again, there are hundreds of thousands of women who have these implants, who are happy, who don't have these types of symptoms, it is important to realize these implants are much improved. The outer shell is much stronger, and the rupture rate is a lot lower than it used to be. And the silicone inside the implant now is a cohesive gel. It's a gel that sticks together. So even if the implant breaks, it doesn't necessarily leak out and create this huge mess that the old silicone implants did. Well, what about the gummy bear implants? You may have heard of those. Well, traditionally, the gummy bear implants are textured surface, teardrop-shaped implants. And these implants became very popular once they were released. But the problem that we are finding over the last several years is that the textured surface of these implants is associated with a risk of a very rare type of cancer, ALCL, anaplastic large cell lymphoma. And because of that, I do not use textured implants anymore. Okay, so I've literally only put a handful of them in my practice, thank God, because I don't want my patients to be at risk of developing ALCL. As of this recording, there have been a handful of people who've died from ALCL. It is very, very rare. Okay, this is not something that is a high risk by any means. There's, as of this recording, several hundred people throughout the world who've been diagnosed with it, confirmed. But it is enough of an issue that I do not use textured implants anymore, and I don't recommend my patients have them. Now, if you are looking for that firmer implant that the gummy bear implant is, Allergan has a smooth-walled gummy bear implant. Doesn't have a textured shell. It is round. It is a bit firmer, and we do use that in certain cases where somebody is looking for that type of an implant. But I otherwise do not use the textured surface teardrop-shaped gummy bear implants. It is important to realize that no breast implant is a permanent device. If you have one put in, you're going to need to switch it out within the next 15 to 20 years. They won't last you the rest of your life. But the implants do have a 10-year warranty. If the implants break within the first 10 years, the company will replace them, and they'll pay upwards of $3,500 for silicone, $1,200 for saline. Okay, so keep that in mind. This is not a one surgery and you're done. If you have breast augmentation, you're going to need to have future surgery down the line. Well, what about smooth implants versus textured implants? Well, in my practice, I mentioned earlier, I'm not a fan of textured, so we prefer smooth implants. I feel that they're softer, they feel more natural, and they move more naturally in the body. It also passes the hug test, and that is when you hug somebody, the person doesn't necessarily know you have implants. Once again, I don't prefer the textured implants, those gummy bear implants. I don't like the feel of them, but even more important, the concern with ALCL, so I don't use those anymore. There are many different types of profiles. The profile is how round an implant is. Anything from an ultra high profile that's quite round, as you can see up there, to high profile, moderate, moderate plus, moderate, and low. In general, the middle of those are what we use in most patients. Anything from a low plus, which is the same as moderate, to a high profile implant, that's what I use in most patients because I do find that that gives people the most natural results. In general, I put the incision, put the implant in through underneath the breast. About 90% of women, in my opinion, across the country have it done this way, and I do believe it has the quickest recovery and the lowest risk of complications. So that's the scar that I use in most patients. Sometimes we go with a scar around the areola. It's usually well hidden, but studies are showing that it does have a higher risk of complications, and so I don't recommend this as a first resort if you're having breast augmentation. I usually recommend going under the breast as a better option. What about above or under the muscle? Well, the majority of patients I go under the muscle. It's called a dual plane. Now, the main benefit is that there's a lower risk of complications, and the main one's called capsular contracture. When you put that implant underneath the muscle, the risk of excess scar tissue, the risk of a capsular contracture, is lower than when it's above the muscle. Also, the muscle will cover the top half or so of that implant. So any irregularities at the top of the breast are at least partially camouflaged by that muscle. But where it is not camouflaged are the bottom and the sides of the breast. And that's where you may see or feel the implant a little bit more. Also, doing a dual plane or under the muscle technique is better for mammograms. But what are the negatives? Well, it is more painful and there's more swelling. So initially, your breasts feel like they're swollen way high, sometimes just under your collarbone. And it can take anywhere from 3 weeks to 3 months for them to truly soften and settle in. And it's important to realize that when it's under the muscle, the implant will move when you flex that muscle. Well, sometimes we go above the muscle. It's called a subglandular pocket. That heals faster. You have less pain. You don't get the movement with the muscle flexion. But you do have the negatives, and those negatives are a higher risk of capsular contracture. You get more visibility of the implant, more wrinkling, more rippling, and it is worse for mammograms. And so for that reason, I usually recommend going under the muscle in most of my patients. Surgery takes about an hour and a half. It's a general anesthetic. I usually do it over at Beaumont and Troy. It is outpatient surgery, okay? The goal is to do this as safely as possible. It's holistic plastic surgery. That's the whole idea. After surgery, you're going to feel some pressure for a few days. It's going to feel like somebody's sitting on your chest. You may take some pain pills during that time, but most people are off the pain pills after just a couple of days. They're driving within a week, and they're feeling good and pretty much doing whatever they want to do within 2 weeks and working out within 3 weeks. In select patients, I do something called a rapid recovery breast augmentation, and that's a combination of the techniques that we use with the holistic protocols and with a reasonable implant size. We do have you wear a support bra for the first 3 weeks or so. So how are they going to look? Here's a patient before on your left. There she is at 2 weeks, and I cut off a little bit, but that's 2 months afterwards. And you can see that the breasts do change quite a bit. They start off a bit high, they're a little shiny and swollen, and eventually they soften and settle in. Well, patients ask, how will I look? And the answer is you look like you do now, just bigger. So if you can take a peek, her nipples are a bit asymmetric, okay? Her nipples aren't in the same place. We make her breast bigger, and that asymmetry will persist. And so in a face-to-face consultation, we'll do some measurements and I'll try to point out any obvious asymmetries that I see so that you know what to expect after surgery. And people ask, will I have a space between my breasts? Well, that's pretty straightforward. If there's a space now, there'll be one after. It's just the way you're built. Okay, but if there isn't a space before, then there should not be one after surgery. Okay, so it really is how you start off with. If you start off and your breasts are out to the side, then unfortunately they'll probably be a bit out to the side afterwards. But if they're not starting out off to the side, then there should not be afterwards. So here's just a couple of examples of some before and after pictures. I try to go for a natural result in my patients, although some people want a bit larger, other people want a bit smaller, and so it really depends on what you want. And I really want to emphasize that for my practice, really the size used, the size chosen is up to you, okay? And my goal is to help educate you so that you make the best decision for yourself if you're thinking about breast augmentation. So that is it. I hope that this has been helpful for you if you are considering enhancing your breasts. Breast implants are the way that we do it in most patients. I do believe in general it's a very safe surgery. It's one of our most popular operations that I do, but it is important to be well informed because this isn't a one and done and there are potential risks and you want to know about it before you do it. So thank you so much for watching. My name is Dr. Anthony Youn, America's holistic plastic surgeon. If you're interested in a face-to-face consultation, give our office a call and I would love to meet you. Thank you so much for watching.